Okay, here we are. So I thought, so here we are. So we're going down this from the abdomen. Remember, we have to be systematic. So start with abdomen, stomach, the same side as the aorta there. And if I go up, this is the 4-chamber view. Okay, don't tell me this is normal. If anybody says normal, you're on the wrong webinar. So here, so clearly it's abnormal. Okay, so what's the abnormality? Well, the apex. Is it made by the left ventricle? So the ventricle, so the right side, this is the right ventricle, and the right ventricle looks okay. Is actually what you see here, the apex is made by the right ventricle, not the left ventricle. Okay, number one. And then the other thing, you can see the contractility of this left ventricle. It's ballooned. It's a fibroelastosis. It's echogenic. The word is echogenic. And you see the contractility is reduced because it's a case of critical aortic stenosis. Okay, so normal, abnormal, 98% of you got it abnormal, which is correct. And 44% of you got the correct diagnosis, which is a critical aortic stenosis. And this is, if you don't do anything, the natural history will be to become the hypoplastic left heart syndrome. And therefore, that means the baby will not be able to have two functioning ventricles, and they end up by having univentricular repair or Fontaine circulation. And this would be a case that's candidate for prenatal intervention, like doing aortic valvuloplasty, to actually try to avoid or reduce the chance of the baby ending by hypoplastic left heart. Not always successful, but I think that will be a good candidate for prenatal intervention. And again, it's associated with genetic abnormalities. So in this case, you will be obviously offering genetic testing. Katia, any comment?
Well, a full-blown case is quite easy to diagnose because it's so specific, so typical. But we should remind that sometimes early in pregnancy it's not so obvious, that it could be difficult. And I've seen cases where there was just a little bit of a smallish aorta, and then with advancing gestation, the full-blown critical aortic stenosis was there with the fibroelastotic change of the left ventricle. So we should be aware of the fact that early in pregnancy the diagnosis may be quite tricky.
Yeah, and therefore I think if he's seeing a patient because they had a previous child with aortic stenosis, don't just say at 20 weeks, yes, it looks good, no problem. I think follow up this pregnancy because it might develop later. Yeah, it's good.